Everybody about this offline, interactively through email, or after the session. Thank you.
Lori, thank you.
In one of the federal Alzheimer's disease centers to developing and conducting federal research, particularly relevant to today and why Gail invited me to join around caregiving. Before we even thought of technology in terms of working with family caregivers, to more recently in applied research centers. And now most recently being able to start de novo Center for Technology and Aging with support from the SCAN Foundation to look at these technologies not from a research perspective, not just from an applied perspective, but from the perspective that we know these work. We now need to take them to scale. And I'll speak to you about some of our initiatives briefly, but then I'd like to refer back to the survey, which I can only commend the two organizations for doing an excellent job, which I think will really contribute to our looking very carefully at how we can engage family caregivers and the importance of their role in working at improving care, addressing chronic care, addressing all the issues we've been hearing through yesterday and today's sessions. So with that, may I have
Yes.
We're going to pass the baton down. As we focused on this area and tried to identify how we could have an impact in this space, we decided that looking at the independence of older adults, ways that it could be focused, there are a number of significant technology areas that have already emerged, already have strong evidence, and we're looking at evidence-based programs, how they can now be moved to widespread deployment, adopted by not just individual organizations, not just in a pilot format where they're dependent on one-time funding, but are really ready to be sustainable and roll up in a very large way. We've looked at these specific areas ranging from some of the topics we've heard over the last sessions, medication, reconciliation, adherence, monitoring, to remote patient monitoring technologies that we're seeing such excellent representation of today, assistive technologies, but also from the workforce side in terms of the formal workforce, how training and technology can be used to benefit the professional and paraprofessional workforce in this area, and how it can support family caregivers. In addition, specific technologies that can help improve older adults themselves, such as cognitive fitness and social media, which is really breaking through. And the one that I'd like to add to what Lori had already mentioned, the mHealth, the cellular and mobile platforms that we think are just on a huge breakthrough. In fact, where we're learning more from international perspective about how this can work and from other population groups. Most recent being a program that we're involved with analyzing with the federal government called Text for Baby. So we should probably be over in the mommy group today talking about that, but a text-based program that in 1 year has gone from a lot of the products that we see here at CES and taking them, again, to scale. We're obviously looking at areas in terms of how they can improve the efficiency, the basic health and independence of older adults. Obviously, cost is being what's driving so many areas at this point. But we believe that it's going beyond that, that these have to be programs now that can get traction, that have, like some of the people who will be presenting later today, been at this a number of years and are now growing these programs in a large scale, both in the public systems and privately, since we see the need for this in all areas. I'd just like to share with you one specific program. This is our third funding cycle. The first one focused specifically on medication optimization technologies. The second one 6 months ago, which has also been expanded by other foundations who have now supported new grants. We have 7 sites that are doing remote patient monitoring. This third area has been a collaboration with the U.S. government on the Administration on Aging and CMS, the Centers for Medicare and Medicaid Services, to look at a way that we can help expand their work to reach family caregivers and older adults through the Aging and Disability Resource Center system, a nationwide program that is targeted at creating single point of entry programs for older adults to find services they need, and with our specific attention, looking at care transition issues, because this is the key issue that we're looking at as one of the ways we can save significant dollars for our society, hundreds of millions of dollars a year, in reducing inappropriate readmissions, untimely admissions, as well as moving people into very effective programs where there is communication with the person who has a chronic condition, their family member, and the service providers that work with them. In this case, we are specifically supporting 5 states who have developed programs that relate exactly to what Gail has said. The areas, and this is where it's very intriguing to see how the survey data can support what we're seeing in the real world, and the real world in terms will also support this, that 3 of these programs are using personal health records, their systems, to move them out throughout their state, and making them available for older adults to ensure that information can be shared quickly. They can control and self-manage their data, as well as work very efficiently with providers. And in addition, these programs are working in a way that they can completely be synced in to these single point of entry programs. When people need information in the state, they can call to these central organizations and get information about care transition programs. 2 of the other states are doing evaluations. One is specifically looking at how to roll out technology as supportive program throughout the Veterans Administration if they're through a trial with their program. A few quick takeaways, and then since we do want to have time for the full audience, I just wanted to reinforce that not only personal health records, but the caregiving coordination system and medication support system that Gail's team identified in the survey keep coming to the fore in terms of empowering individuals to take control of their health situations. When you see 3 out of 4 people requesting this type of area and seeing the benefit of it, even though there's still fear of cost and how they will best use it, it's showing the potential for technology to have a fantastic impact in this area. So we look forward to hearing more. Know that this survey will have a lot of traction, particularly as you look into the details of it. It will be helpful for service providers, researchers, and policymakers in a very large way. And again, can only commend you for it. Thank you very much.
Thank you, David. And let's cap off this afternoon of experts with Andy Cohen, who's the CEO and founder of Caring.com. Okay. Andy?
Great. So I'll go quickly so we have a couple of minutes for questions. But I know this is called the power of technology in senior health, and I was just hearing all the great data. I was thinking we should have called it the power of senior health and technology, because there's going to be this huge impact to technology. And I think you all in this room probably believe that the power of senior health and technology, but maybe others in your organizations or potential investors or partners don't believe that. So for a couple minutes, we're going to just talk a little bit about the growth we're seeing in the market and share some data in addition to the great data that the study produced that you might be able to use in your own organizations to help you make the case that senior health is going to be a big force in technology. And my front row seat on this is through our website, Caring.com, which is a website for family caregivers. So we're